the Congenital Heart Disease Center is one of several centers that focuses research in a particular area related to children's health. In the Congenital Heart Disease Center, the focus is obviously cardiovascular disease in children. It includes a number of investigators that have all had funding from the Children's Discovery Institute for a variety of different reasons related to their research. It includes all types of heart disease that affect children, and it's an opportunity to bring those investigators together, to collaborate with each other, to interact and hear different people's ideas. Even though they may not have the exact same research question, they're still broadly interested in cardiovascular disease in children, and we can often learn from each other, even though the research may not be the exact same type of research, different ways to approach research problems. So the center really covers all types of cardiovascular disease in children. A lot of childhood cardiovascular disease is related to structurally abnormal hearts, so what we would consider heart defects. Children that are born either with holes in their heart or a heart that's really been malformed from the very beginning. It may have only a single chamber in the lower part of the heart, a single ventricle. It may have blood vessels that go into it in the improper way. So that's a big part of heart disease in children, and it's a large part of what we treat in the Children's Hospital when you talk about heart disease in children. But there are also children that have more medical heart disease. So heart failure is probably the best example of that. And heart failure in children is very different than it is in adults. So most adults with heart failure have heart failure because they've had a heart attack or a myocardial infarction, and so part of their heart muscle has died, and that's why it doesn't pump normally. In children, heart failure happens for a very broad range of reasons. So some of them have heart failure because of that structurally abnormal heart they were born with. They may have done well for a period of time after surgery, but then the heart begins to fail later because it never formed quite properly to begin with. Other children develop heart failure because they were born with abnormal heart muscle. The heart itself was formed properly, but the muscle's just not working the way it's supposed to, and over time they develop heart failure. And we also see a lot of children that develop heart failure because their heart has been attacked, for instance, by a virus. My research really focuses on heart failure, and my hope is to really try to understand one of the basic mechanisms that contributes to a failing heart. And as I said earlier, heart failure in children really comes from a variety of different original diseases, but I'm trying to understand one of the basic common mechanisms that may contribute to the failing heart. So I study mitochondria. Mitochondria are really the energy center of every cell. They're the engine. They are what allows that cell, all the different processes that happen in a cell, to work properly. So without normally functioning mitochondria, without a normal amount of energy, those different processes can't work the way they're supposed to. So the heart, as you might imagine, it beats many times a minute, many minutes every day for many years, and it has a lot of mitochondria. And one of the things we now know is that the mitochondria, if they are abnormal, can contribute to heart failure. And that's true across a variety of different diseases. No matter what the cause of the original cause may have been for the heart failure, the mitochondria are a central component to it. So my hope in my research is that I can understand basic mechanisms that contribute to normal and abnormal mitochondrial function so that we can help better treat heart failure. So over the past several years, my research has been focused on heart failure associated with diabetes, which many people think of as an adult disease, which it is, and there's a lot of adults that actually develop heart failure related to their diabetes. And we know that one of the causes of that is that the mitochondria become abnormal. There's abnormal metabolism, they don't make enough energy, and the heart begins to fail. And if we can understand that, we'll understand a lot more about whether or not it's possible to reset that metabolism. If metabolism is altered during development, then maybe we can reset it so that those children are not at risk for disease later on in life. I think it's also important, I work in the intensive care unit, and we see a lot of changes in metabolism in children that come in with a critical illness. So this isn't just important for diseases later on in life. If your mitochondria are abnormal from the very beginning, you may not compensate well if you are in a car accident or have cardiovascular disease already, have an abnormally structured heart, but you also had abnormal mitochondria from the beginning. So it'll allow us really some basic understanding of how metabolism works, how the mitochondria work early on in life, and how we can maybe prevent some of those diseases and some of those abnormal responses to stress in children after they're born.